Welcome to Menopause 101. For 52 years, we have supported the use of hormone replacement therapy in menopause. The reasons are because that is an excellent way to manage all the symptoms and all the problems that women have to confront with this condition. I am Alberto Dominguez Bali, obstetrician, gynecologist, and sexologist. And with me, Catherine Dominguez Bali will be in this new podcast. Welcome, Kathy.
Good morning. I'm Kathy Dominguez Bali, and I have been a nurse for many years, also more than 30. Also in the last 20 years, have been working in the area of human sexuality and menopause.
The reason of this podcast is because we have been living for the last 24 years a situation that is totally unfair against the woman's health, and is the consequence of a study that was published in July 17, 2003, saying that hormone replacement therapy is definitely a bad medication, a dangerous medication that can produce so many bad side effects. Despite that for more than 40 years, we knew exactly the opposite. This study of 2003 changed totally the situation of the management of menopause, and millions of women stopped to use hormone replacement therapy, and hundreds of thousands of physicians stopped to prescribe them. The consequences were a disaster. Dozens of thousands of women start to die prematurely in the United States, at least due to the lack of use of hormone replacement therapy. Today, we want to share with you in an informal way our experience during all these years going against the opinion, going against practically the law using these kind of substances, but never failing to maintain the health of the woman. Kathy can explain what is our daily experience. Daily is not an exaggeration. On a daily basis, dozens of women go to our two centers and present in a situation like she will describe.
One of the first encounters that I had was at 7 a.m. when the doors opened, a woman coming crying hysterically, saying that she feels that her whole life is in front of her and she feels lost. She feels that she will lose her husband. She has children with him, 40 years of togetherness. And, well, she was going into menopause.
The problems are the problems that most of women in this age share. Painful intercourse, depression, unable to sleep during the night, hot flashes, night sweats, irritability.
So she said that she now didn't feel comfortable to have intercourse with her husband because she was too dry. It was too painful. She didn't know about her irritability, and all that led her into a stage of depression. So the multiple doctors that she had been seeing, including a psychiatrist, started her on medication for depression, which led her to become even more depressed because she was lethargic, she didn't have appetite, for food, for life, for sex, it didn't help in any way.
What is incredible is that during these last 23 years, physicians have been rejecting hormone replacement therapy as one of the medications that in almost every specialty we should use, because the good benefits that in every specialty, in every area of our economy of our anatomy and function, hormone replacement therapy play a good role to maintain the function. So a psychiatrist don't know that menopause produces depression. The woman in the middle age came with depression, and traditionally depression has been diagnosed as a crisis of the middle age. It's not. It's menopause, and she's treated like Kathy said,
and then
antidepressants
and for insomnia, medication to sleep, which made her even worse the next day in functioning.
Once they arrive to our office or clinics, we do in an easy way. It's not difficult to do the diagnosis of perimenopause or menopause. And if definitely she has symptoms like we have reported, we start hormone replacement therapy. The effects, you can say what happened just 4 weeks after the initiation of hormone replacement therapy. The explanations, the happiness, the change in the facial expression changed totally in this woman.
They were able to have intercourse again. She was able to feel romantic again, pretty again. She felt like she was sleeping better, and everything, her mood changed. When she felt angry and she thought to herself, that's not me. Why am I responding like that? Or yelling at a situation.
All that can change. In one way or another, women in menopause develop these kind of symptoms. There are a little percentage of women who enter in menopause and doesn't have any symptoms. The big mistake is to believe that because you don't have symptoms, you don't need hormone replacement therapy. Really, in fact, the most important reason for women and men, but the most important reason for women use hormone replacement therapy is not to control symptoms that bothers them and make the quality of life so bad. The main reason, and that is not known by most of the people, including physicians, is to prevent silent and lethal diseases. Examples of them are myocardial infarction, diabetes, Parkinson, Alzheimer's disease, osteoporosis, sexual dysfunctions. All of that can be controlled when hormone replacement therapy is established, when the ovaries start to decrease their production. What else we should say? This is a podcast. This is a podcast to promote the knowledge of menopause and to promote the use of hormone replacement therapy. Finally, at this moment, in the last year, there is an explosion in which people have realized that water wet. What that means? People have realized that definitely hormone replacement therapy need to be used. And now big personalities in the countries are dedicating hours to make huge programs for something that has been always there, for something that has been denied. And this is time, finally, to promote, to expand, to give security to the woman that hormone replacement therapy definitely will improve the quality of their life and will extend the lifespan. If we follow the woman 3 to 4 months after the initiation of hormones, what is the result that we have seen?
She exercises, taking care of herself, weight loss instead of weight gain. That's a myth. And she is more positive. She starts to, as we say, study a language, do an outreach program,
We are going to present in the National Association several studies. One of them, one of the studies is in an association of sexuality, the most important society in sexuality in the United States. And one of them is to show how the women who are in hormone replacement therapy are the women with better quality of life and better sexual activity in all the ages that we found in our patients.
I think it's important that people have the capacity to identify their issues. For example, when you're hungry, what do? You search for food. When you have to use the restroom, you search for a bathroom. In this case, a lot of times people are not in tune so much with their feeling. They know what desire is, and they know their husband's desire, but they're not in tune with the connection between an issue with desire and a perimenopausal condition.
That point is one of the most important. Women lose the desire to have sex, and men start to continue having sex and required to have sex, and most of the time the expression by woman's part is the same one. Doctor, he is telling me that I am having another guy, or that I don't want him anymore. And it's not. Men need also to know what happened when women enter in menopause. So, to improve the quality of sexual life is one of the important issues. It's not the most important. The most important is to preserve the life, to prevent myocardial infarction, to prevent osteoporosis. Those are more important because those bring you to the tomb. But sexual activity is extremely important in the relationship of any couple, and that is maintained, supported, and stimulated by the use of hormone replacement therapy.
It's important that we understand as women and men in a relationship that sometimes sex, you come home tired, you come home with a lot of mental burden, and maybe you're not really into an intimate moment tonight. But ask yourself a question. Are you interested in doing exercise tomorrow? And the answer most of the time is no. But once you complete the exercise, how do you feel? How do you feel? The same with sex.
That is another thing that is stimulated by the hormone replacement therapy. One of the symptoms is anergia, which means you don't want to move. You don't want to do anything. You prefer to be laid down. Hormone replacement therapy gives you the stamina that you had when you had your younger years, and the energy that you remember to have had during those years. That is also another part of the symptoms that postmenopausal women develop. This is a problem. This is a podcast that look to remove all the myths and all the misinformation and all the false conception that just one study, unfortunately, produced in the entire American society, and I could say without hesitance, that in the entire world.
Let me ask you, doctor, if a patient hasn't seen you for years and came to you like we had last week, doctor, I'm here to see the professor because I haven't seen him for 19 years, but I'm purely in my menopause condition. Everything is hot for me. My relationship is a mess. I feel hot flashes. I'm not sleeping. I'm having arguments with people at work. My life is unsettled. And now I want to take your advice that you offered me years ago and go on hormone replacement therapy. What would be her outcome?
Well, depends on the age. We know in medicine that hormone replacement therapy needs to be started in the first 10 years of menopause. The earliest, the better. But the 10 years of menopause is the protocol window that we have to start hormone replacement therapy. Up to now, after 60 years old or after 10 years in menopause, is not supposed that you use hormone replacement therapy. But the number of women who came to our offices older than 60 years or for more than 10 years in menopause with the symptoms, with a poor life, hearing that other women are using hormone replacement therapy and they feeling need to do it, is high. It's 60% of the women that arrive to our centers. And I know that at this time, the only guys that are doing something that has been prohibited is to study those women, and if they have certain characteristics, we have demonstrated that they can use hormone replacement therapy despite to be more than 10 years in menopause if they have certain conditions. And we have a very important group of women that we are presenting in another society this year, in which we start hormone replacement therapy in the late 60s, in the late 70s, and the results for the last 5 to 7 years has been as good as the result that we have had with women who enter in menopause in the first 10 years of menopause. So that is a good news for women who had the lack of luck to be placed in hormone replacement therapy before when they start menopause, and now they came late, but there is a hope for a very good number of those women to start late.
Okay. How about, and the treatment that you give, how about those women that come and they've received pellets and they feel like during the first few weeks with the pellet in them, they feel very energetic, and then
pellets and chips has been
unstable, they feel unstable.
Yes, pellets and chips has been used for business purposes. Has been prohibited, is not approved by any of the societies that have to do with the care of menopause. Not for Menopause Society, neither for the American College of Obstetricians and Gynecologists, nor for the CDC, nor for the American College of Physicians. So there is no a serious association that support the use of pellets and chips. However, is the most frequent kind of treatment that you heard in the mass media, newspapers, TV, radio, inclusively, of course, in the social media. Pellets give you mainly testosterone. Testosterone is the hormone for the energy, is the hormone for sex. And that is what most of the people are concerned, and that is the reason why most of these business people promote. But the main reason is your life.
Let me ask what they ask. Once you have a pellet or a chip inside of you and it's not functioning, what do you do? Could you take it out?
Remove it. That is still there. And that is what the pharmacological problem with pellets and chips is, that the dose that they provide to the body is very high. Usually it's very high. And second, decrease with the time. Hormone replacement therapy cannot be given in shots for 3, 4, or 5 months. Hormone replacement therapy needs to be given on a daily basis with what is called a physiological dose. Because in many moments of our functioning, one substance, a certain level can produce bad effects, and in the other levels produce bad effects. Only a certain level in the middle produce good effects. Our intention is to provide you scientific and confident knowledge. And the reason of this podcast is that has been always in the media in which we have participated previously in other moments with other programs. But we have decided to do this one specifically for menopause, knowing now that finally the people are open their heart to the use of menopause due to the conscience that we have about that. The new studies really reject what were the conclusions of that study published in 2003, and we are demonstrating the benefits of this therapy. Thank you so much for being with us.
Thank you so much for following us on Menopause 101.